Janela Carrera, driving actually on the road. Morning, Janela.
Hi, good morning, guys.
So the big debut of the University of Guam field house. I know that Jason's mom was heading that, or she's there already, Jay?
Yeah, she's already lining up, and she said they're actually treating everybody really really well. And she said at the time when she was doing it, Janela, maybe about 25 minutes ago, she said there wasn't much of a line.
Oh, great,
Yeah.
great. I'm glad to hear that. She's there before I am.
Uh,
I'm glad to hear that.
yeah. Hey, Janela, can you tell us a little bit about just some of the prep that went into play for preparing the University of Guam field house? I know that since the beginning, people were kind of saying like that would be an ideal place to do a vax clinic. So, if you could.
Yeah, yeah, you're right. Because it's such an open space, and so our logistics team has already set up. I think actually maybe 2 or 3 days ago, they already set up the place. So our tables, our chairs, everything's already been there. Don't mind my phone; it just keeps moving down. It's not locked. It's as secure, but it's already been set up there. So it our logistics team already set up the entire place, so it's been set up for the last 2 or 3 days. But you're right. We partnered up with DPW, Jesse John and his team. So when you get there, actually, in the gate, we already have a ticketing system. So once you enter through the gate, we have people there who will issue you a ticket and usher you into the parking lot, and they'll ask you to stay inside of your car, inside of your vehicle, and ask you to remain there until somebody calls you. And the reason, and this is by design, and the reason for that is because we don't want people to get down from their vehicles and wait it outside, like in the sun or in case it rains. And then when you enter, the flow that we want is similar to how we were doing it at Okudu High School with the 5 different stations. So station 1 is where you get initially signed in and registered, where we'll take your name, your temperature, and then issue you this little slip of paper with a ticket number. And then station 2 is where we'll get your medical consent form, ask you the initial set of questions, if you've ever been exposed to SARS-CoV-2, your medical history, if you've ever had any allergies to any vaccines, or peanut allergies, allergies to foods, your medical history, like if you've had diabetes, hypertension, heart disease, those types of medical questions. If any red flags are raised there, we have medical professionals who review your chart or your medical history. And if all is clear, then you'll go to station 3, and there's a physician there who will further evaluate you. That's medical triage. For medical triage, if you clear that, then you go to station 4. And station 4 is actually where you get your vaccine. And then once you receive your vaccine, then you go to station 5, and that's post-observation. It's about 15 to 30 minutes. 15 minutes if you don't have a medical history of any allergies of that sort, and 30 minutes if you need further observation. So, for example, you had a history of allergies. And so then, so station 5 is post-observation. After your 15 minutes or 30 minutes evaluation, then you're ready to go home.
Janela, so after we take care of the Monumco in their second round, which group is up next to get vaccinated and when?
After that, we move on to those who are 60 and older. So, and this is a fairly large group. So we're going to be moving on to the second dose for those 60 and older. We also have some of our law enforcement and first responders who were kind of getting their second dose or their first dose alongside those who were 75 and older, and also those who were 60 and older. So that's kind of happening simultaneously right now, actually. So we're getting some of our law enforcement community who are also getting, and also our healthcare professionals. There's still some of them that we're seeing coming in, getting their second dose as well. So we're still seeing them right now, and we'll continue to see them trickle in because not all of them face 1A. Not all of them got it during those first 3 and 4 days when we had our vaccination clinic.
What about GDOE or teacher staff, or even private school teachers and staff? Are they in the queue, the line?
Yes, actually, I'm glad you asked. We haven't. So the plan hasn't materialized yet, but we are in discussions to partner with GRMC and possibly even one of the enrolled clinic providers to get our teachers inoculated. And so we wanted to actually roll this out as soon as possible, but we're trying to figure out logistically how we're going to do this. We wanted to do this in time for the face-to-face learning to happen. So we wanted to do it actually this week, but so we're trying to figure out logistically how we're going to do this. So, but we are working on a plan to get all of our teachers, including private school teachers. So this is our Christian schools, our Catholic schools, and our other private schools that may not be in the religious categories, charter schools. So all teachers, including bus drivers as well, to get them vaccinated. And hopefully we'll be able to announce that pretty soon. But they'll also be vaccinated, and we're working on a partnership with GRMC. So whether that's going to happen at GRMC or there's some other vaccination clinic, we'll announce that soon. But we do plan on getting them vaccinated, and so that'll be all teachers, whether they're through GDOE or private schools, including bus drivers as well.
All right, so that's pretty much the bulk of you guys' work. Is there anything else in the department going on, Janela? Health certificates, that type of stuff? That any new developments with those services with the PCOR 2 declaration?
Health certificates, no, but you know what? We did make an announcement last night in our JIC release about some of the hours of operation for the welfare division. Just looking out for those types of announcements with public health. There will be another announcement that's forthcoming with regards to the SNAP and the emergency allotments. That should be coming out today. That will go into effect on Saturday. So that should be forthcoming. But anything else in the department, always just look out to our media partners for those announcements.
Thank you, Janela.
Sure, anytime. Thank you, Chris.
Good luck. All right, there you go. Janela Carrera, Department of Public Health and Social Services. 726 now. That, again, death investigation in Santa Rita. Just going to tell you guys that it's pretty much a homicide. I mean, it is. And we did have a press conference here with Guam Police Department.